Did you know that 80% of women going through the menopause transition experience hot flashes? This vasomotor symptom is considered a cardinal symptom of menopause because it is so common among women. However, there are many ways to manage VMS. With the guidance of patient advocates, researchers, and clinical experts, the Society for Women's Health Research has designed a toolkit to empower women to embrace the changes that come with their menopause journey. Our Menopause Preparedness Toolkit is a woman's empowerment guide that provides easy-to-understand information and resources on understanding your menstrual health and menopause, common changes and conditions associated with midlife, managing your menopause care, and wellness tips for the workplace, your personal life, and mental health throughout the menopause transition. In this segment, we'll discuss treating vasomotor symptoms. As a woman enters her late 40s or 50s, her ovaries produce less of the hormone estrogen. Her menstrual cycles begin to change and eventually stop, resulting in menopause. The term menopause is often used loosely to describe the entire time frame of midlife changes. However, menopause is officially defined when a woman's menstrual cycle has stopped for 12 consecutive months. On average, the transition into menopause, known as perimenopause, takes place over 3 to 7 years leading up to menopause itself. Each year, 1.3 million women in the United States enter menopause. Afterwards, a woman is considered postmenopausal. Estrogen depletion during and after the menopause transition can cause a variety of symptoms, including hot flashes, brain fog, vaginal dryness, and urinary incontinence. There are a number of lifestyle, pharmaceutical, and complementary and alternative medical approaches to treating hot flashes. These options range from using cooling devices and wearing light layered clothing to practicing mindfulness techniques and hormone therapy. One important part of managing hot flashes is understanding your triggers. Every woman is different, and not all triggers may be the same person to person. Some women find spicy and sugary foods problematic, whereas alcohol, like red wine or caffeine, may bring on a hot flash for others. Complementary and alternative approaches to managing VMS include mindfulness strategies, including cognitive behavioral therapy, yoga, acupuncture, and herbal and nutritional supplements. Now, more than ever, there are direct-to-consumer products available that claim to ease menopause symptoms. It's important to do your research and talk to your healthcare provider about any home remedies you plan to try, in particular, any herbal remedies, supplements, or femtech products to ensure that they are safe and appropriate for you to use. Hormone therapy provides an option to replace some of the hormones that the body is no longer producing sufficiently. It is the primary medication prescribed to address many symptoms of menopause and can be very effective at reducing vasomotor symptoms. Not all hormones are created equal, and there are different kinds of hormones available for women to take for their hormone therapy. These include natural hormones, bioidentical hormones, and compounded bioidentical hormones. Bioidentical hormones are man-made hormones that are chemically and structurally identical to those naturally produced by the ovaries. These are FDA-approved medications for the treatment of menopausal symptoms. Compounded bioidentical hormones do not require FDA approval and are therefore less regulated. Speak to your provider about the different hormone therapy options and which might be best for you. There are two main ways to administer hormone therapy: systemic, which means the hormones will affect your entire body, and local, which is applied at a low concentration to the specific area for treatment. Typically, systemic therapy is used for widespread symptoms such as VMS. If symptoms are only in the genital area, such as vaginal or urinary symptoms, then the localized approach is often effective. All forms of hormone therapy approved by the FDA are required to include a black box warning label to inform patients of potential risks. These risks may include cardiovascular disease or breast cancer. However, these warnings may not accurately reflect updated research studies, which suggests a minimized risk of hormone therapy for healthy women under age 60 or for women using low doses of localized vaginal estrogens. Anyone considering hormone therapy should talk to their healthcare provider to determine if it is a good treatment option for them based on their personal medical history and risk factors. There is no need to feel embarrassed about discussing your symptoms, nor should you dismiss their severity or your desire for treatment. If you have symptoms that are disruptive to your daily life, discuss them with your healthcare provider. They can only help with issues that you tell them about. Sample questions to begin these conversations might include asking about the cause of your symptoms, medical and non-medical treatment options, long-term health, and resources for additional information and support along your menopause journey. Additional questions can be found in SWHR's Menopause Preparedness Toolkit online. A menopause care journal is also provided in the toolkit to help you track your symptoms over time so that you can be ready for your next visit. Keeping a menopause journal allows you to share a more complete picture of your experience with your healthcare provider. For more information about the menopause transition or to download a copy of SWHR's Menopause Preparedness Toolkit, a woman's empowerment guide, visit our website, www.swhr.org. We also invite you to follow us on social media or sign up for our newsletter to get the latest in science, education, and policy concerning important women's health topics. We'd like to thank everyone who contributed to the development of this toolkit, especially our Menopause Education Working Group, House Cat Creative Publishing, LLC, and programmatic sponsors Astellas and Pfizer.